Any questions on those scenarios? I think I answered a handful of them walking around, but yep.
I just overheard two different interpretations of one of the questions.
Which question? Let's look at it.
Sorry, the way y'all answered it was different than the way we did. The pricing one, where it's
Yes.
so that one, if they know the quantity they gave, do you write down the amount they paid that year or the $65?
So I want what they paid that year because they still have the leftover in the bottle that they can use in future years, right? So
So 65 or the 130?
the calculated version.
But they still spent it that year, right?
But it wasn't product that was used, so they'll be able to use what that product cost in future years.
It doesn't expire.
Hopefully, right. And they may, I mean, where's that question?
It's on page 11.
Thank you. Yeah, so it's the deworming products administered to the goats. Does that clarify?
If the deworming product is administered by the veterinarian, charge.
No, you do not. We only want to know products. So if you count the cost of the product, not the cost of the veterinarian's time, or if they gave it, they had an administration fee, don't count that either. That's the hard part, yeah. If they don't know, take your best guess. We expect people get really hesitant when you start talking money. And so we're going to take these answers with a grain of salt. Give it your best shot. That's why you'll see there's only one money question in the whole questionnaire because we know
Never
that.
ask how many goats. Like chicken now, it's yes, there are.
Yeah, exactly. So we expect that to be a rough estimate. Do your best to get that number. Any other questions on those two sections? Also, one important topic that was brought up at this table here was safety. Your guys' safety is our #1 priority. So when you're out visiting operations, if you just don't feel comfortable, don't put yourself at risk. Don't go. If you're a little worried about a producer, maybe bring someone along with you, something like that. And that goes for the biologics collection as well. If you ever don't feel safe collecting from a goat, then don't get those samples. Your guys' safety is our #1 priority. So don't ever put yourself at risk for this study. But yeah, keep the animals and yourself safe.
If you get there and then suddenly don't feel safe, pretend you're gonna take a phone call, tell them the office called, do you have an emergency that you have to attend to, reschedule an appointment and take somebody back with you.
Good point. Okay, any other questions before we move on to section E? So section E covers goat and herd health. These definitions are in section 4, page 64. So the first questions, question 1 is how many of your operations does were in milk during the previous 12 months? You'll count each doe once. So if she was in milk at the beginning of the year, got dried off, and then somehow came back and she kidded and came back into milk that same year, only count her once. And then that goes with question 2 as well, which is how many of the does in milk had clinical mastitis in the previous 12 months. So if a doe had multiple bouts of clinical mastitis, you'll still only count her once in that question. E3 is about how clinical mastitis is diagnosed. So if an operation uses multiple methods, mark the one that they used most frequently. Let's say that every time they do a CMT and they also look at the milk, put that in other and just say 1 and 2 are done every single time. So let's see, a what if here for E2. What if the producer thought a doe was producing less milk, so he did a visual CMT that was positive, but she did not have, or she did a CMT that was positive, but she did not have any visual changes to her udder and or milk. So this would be considered subclinical mastitis. We only want to know about clinical mastitis. So to be counted as clinical mastitis, they should have visual changes to their udder and or the milk. So the bag should either be hard or swollen, or the milk should be clumpy. We don't want to know about those subclinical cases. Oh. Okay, E4. So this question is about the about abortion in bred does, and it's a screener question again. So did any bred does abort in the previous 12 months? If no, you'll skip to question 7. If they didn't have any bred does, make sure you mark the NA there. And if they did, we'll answer questions 5 and 6. So ignore that big note there because I think it's a little confusing. So I wrote myself some notes. So we'll just walk through E5, which are the steps taken when you have an aborting doe. So were any of the following steps taken for an aborting doe? And you can mark yes or no for each specific step. So remove placentas or fetuses as soon as possible. Clean the area by removing bedding and or dirt. Disinfected the area. Physically separated does that aborted from other does. So if they marked yes for that last one, D, you will ask then, were they permanently removed from the herd? Were they not returned to the herd for the rest of the kidding season? Or they were separated and then returned to the herd? And if that's the case, how many days after aborting were they returned to the herd? So what if for the E4, what if early abortions are not observed? It is unknown if the does aborted or never took. So use the producer's best information if he or she can provide and indicate in the that he or she can provide, and then indicate in the margin any other information and just say, you know, there may have been some unobserved abortions that occurred. E6. So this question asks about cause and diagnosis of abortion in does. If they say yes to one of these diseases in column A, then you'll follow up with column B, which is if yes, was this disease diagnosed by a vet or a lab? So for this, let's say, what if they had abortions due to toxoplasmosis that were diagnosed by a veterinarian last year? So they suspect that this year's abortions were due to toxo as well. So you'd select yes for item E6D, E6C, toxoplasmosis, for abortions suspected to be caused by that disease. And then you'd select no for the second column since these abortions were not diagnosed by a vet. It was the previous year's abortions that were diagnosed by a vet. So question E7, A through E, once again, if you say yes in the first column, you'll answer the second column. So this is disease occurrence in the goat herd, and this is in the previous 3 years. That's bolded. So that's one of our time changes a little bit, so just be aware of that. And I think that question, other than the time frame, is pretty straightforward. If 7E is no, you'll skip to question 10 because question 8 is about sore mouth. So how many goats and kids in your herd had sore mouth, suspected or confirmed? So once again, it doesn't have to be confirmed during the previous 12 months. So we want the number of head there. And then 9 is pretty straightforward. Of those, how many died? So if they didn't have any, those 2 should be blank. If question 8 is 0, skip question 9 and move to 10. Question 10 is about producer, employee infection with Q fever or sore mouth. So we want to know if they've ever been infected with either of those diseases or thought they were infected, and if yes, was it diagnosed by a doctor? When we were going through various versions of this questionnaire for a while, I'd had veterinarian there, and we changed it to doctor, but I thought, oh, well, veterinarian might be more accurate. So, but yes, was it diagnosed by a doctor? And then E11 in that section is about vaccinations. So during the previous 12 months, injections, were any goats given an injection? So if you did vaccinations in section B, question 6, I would expect injections to be marked here. So just something to think about and a way you can kind of check yourself as you move through the questionnaire. The next follow-up question is if a new needle was used. If a new needle was used, you'll skip the couple questions about disinfecting the needle between goats. And that's E13, which is chemical disinfection. So a couple what ifs for these guys. What if the herd has an ongoing problem with CAE that was diagnosed 5 years ago? Since the problem has been ongoing for 5 years, the first column is checked yes for CAE. And you would check diagnosed by a vet in the second column since it was diagnosed by a vet. E13 in this section about the chemical disinfection, we want to know about what they normally do. So the chemical disinfectant, they use a chemical disinfectant when giving IM injections, but not when giving SQ injections. You would mark no there. Or what if they say, well, I try to chemically disinfect, but sometimes I miss one or two, then you would mark yes. So we want to know what they're generally doing. And then a last one of there. So let's say they say, well, I chemically disinfect except for when I give a modified live vaccine, then you'd mark yes, because generally they're chemically disinfecting between vaccines. Yes.
So on E6, you had the one issue in those abortions that were 2 years ago diagnosed with toxo by veterinary. You told us to mark yes, toxo, but since it wasn't in the last 12 months, no for diagnosis.
I know.
And then you switched that on 7 and said if it was CAE, you could do both.
Yes, and I realized that as I was going through that. Kat, do you know why we chose that? Or should we have it in that 3-year time frame? Because I agree, it would make sense if it didn't happen, if it wasn't diagnosed in that 3-year time frame, then we should say no.
One way or the other. But
Yeah, I agree. Okay. These are some of the, this is where it gets tricky. And it's nice to be able to do this in a room versus over a webinar, because these questions come up and we can think about it. I agree, let's keep it the same either or. So let's say it's either that time frame, and we'll let you know here in a minute, or it has, if it was ever diagnosed, then you'll mark it. Jody, did you have a question?
Yeah, so I know that you're asking specifically about the chemical disinfection of the needles, but like oil and needles, something like that. Can we mark that somewhere, or is this only chemicals?
I would say only chemical disinfection, since that's what the question is asking. I think that is still a way to disinfect, obviously, but I don't know, wouldn't it like ruin the quality of the needle? It seems like a bad idea, but I mean, probably people are doing it. So I would say let's just answer for only chemical disinfection. Any other questions? And we'll get back to you on that time frame one. Okay, so that is what I have for section E. Let's move through section F, and then we'll do those two scenarios together as well. So section F covers antimicrobial use in the feed and the water. So F and G are all about antibiotics, and that is a big topic here at VS, so I think it's important that we walk through these and cover all of that information. So for these questions, feed includes milk, milk replacer, and starter when we're thinking about the pre-weaned kids. So when you're thinking about feed, keep those in mind as well. And then useful definitions are section 4, page 68. So F1 in this section is your screener. So did this operation use a coccidiostat in the feed or water from September 1, 2018 through August 31st, 2019? If no, you'll skip to question 3. So if they did use a coccidiostat in the feed or the water, we'll move on to question 2. In this question, you'll answer for both feed and drinking water, and you'll check what they used. So whether it was an ionophore, decoquinate, amprolium, or a sulfa drug. If they're using a sulfa drug, we want to capture a little more information on that since it is an antibiotic. We want to know the number of adults treated and the number of kids treated, and then the number of days treated per animal for that disease. So I have a little what if for that to help explain. So let's see for that. So let's say for an example, an operation had a coccidia outbreak in their pre-weaned kids last year with that they treated with a sulfa drug in the feed. They treated all 30 kids for 5 days. However, about 2 weeks later, they had another outbreak in those same 30 kids, so they treated them for another 5 days. So to complete 2D, you would check yes. For feed, you would write in 0 for the number of adults. So no adults were treated. For the number of kids, you would write in 30 for the number of kids. And then the average number of days would be 10 since they were treated twice, 5 times. So that would be the total number of days treated per animal. Does that make sense?
What if there was more time between both treatments, but it was still twice?
I would still count. We want total number of days per animal treated.
So you want total number of days, not the average number of days?
We want average number of days, but like for that per animal. Does that make sense? So let's say that you had multiple groups of animals. You treated some for 5 days, you treated some for 7 days. So your total number of animals would be, let's say you did 10 and 10. Your total number of animals would be 20. Your average day of treatment would be 6. Does that make sense? So yes, average.
Okay, that's what I was clarifying.
Okay. So 3 is once again another screener, or nope, sorry, this isn't a screener. We just want to know if they've used any ionophores as growth promotants in the feed. So that's a yes or no. Pretty straightforward. So F4 is our screener as to whether or not they used any antibiotics in the drinking water to prevent, control, or treat disease. So you'll mark yes or no there. If they have used antibiotics in the water, then we'll fill out these tables. On these tables, it's best to work left to right. If a goat type was not treated, you'll mark no and move on to the next goat type. Let's say they had no kids on the operation, write an NA in there for us so that way we know, and we'll be able to check that with the information provided earlier as well. So let's say that they gave antibiotics in the water to their kids, then you'll go to the next row, and for each disease type, you'll write yes or no, whether they used it. Examples of others in this section may include a group was treated for foot rot or joint ill. There may be some others out there as well. And then you can use the antibiotic reference card, which is the last reference card on the back here. So this guy here, to classify the primary antibiotic used. So they may have used multiple antibiotics. We want to know which one was used most frequently. If for some reason, let's say they were used equally, you can write in 2, but preferably give us the one that they primarily reach for. And then once again, we want to know the number of animals treated and the average number of days those animals were treated for each of the disease types as well.
So if they're using antibiotics that are illegal to use in goats, we just ignore it?
So you can report it, but we won't report anything. We won't report illegal activity. It'll all be grouped together. So no one's going to get in trouble for reporting it. Is that correct, Kath? Is that what we should have them do? If they're using illegal antibiotics, still report it, and we'll aggregate it and clean it up at a later date. It'll probably get lumped into the other. That way it's not, we're not highlighting that the industry is doing something wrong. However, we have used it in the past to communicate back to industry that more education needs to happen in a certain area. So that may be something that occurs. We work with AGF or ADGA to say, hey, it looks like there's some illegal use happening in this area. It may be a good thing to put together an info sheet on and communicate with producers about to make sure that we're educating them.
So we definitely want to write it down. Some producers might just have their 5 cat hair buddies and they just never go to water ever. Don't have a company,
Yep.
it might be treating with something that's not necessarily legal, but write it down.
Yeah, just write it down. We won't report illegal use. Yeah, we understand that a lot of these small ruminants or goat producers may be using a small animal vet, and so they may be treating them with dog products, which aren't approved for use, and it may not matter because, yeah, they're never going to enter the food chain. But still report it, and we'll go from there. Great?
So now, is it time to go back to the other question?
Yeah, why don't we real quick?
Alright, So, question 6, there was a question about why we're recording previous 12 months for 6, and the previous 3 years for question 7. So, question 6, I mean, the reason we want 12 months for that is because we're asking about those that worked in the last 12 months. And we wanted to continue that thread for number 6. When we go to number 7, the reason we asked for the previous 3 years, well, there's 2 answers for that. First of all, we asked about 9, previous 3 years, so we want to be consistent. But the reason we asked about that back then is we wanted to make sure we captured, they may not have had that in the last 12 months, that disease, but we wanted to capture best that we could any prevalence for the last 3 years. And so that's why we asked that. And I know it's confusing, but it would be great if we could keep 12 months for number 6 and 3 years.
And that's, I think, yeah, we can do that. That's not the issue. The issue was in the what if scenario. So in question 6, Toxo had been diagnosed by the vet previous to that 12 months. So it was the year before. So we marked no, it had not been diagnosed by a vet because it wasn't in that 12-month time frame. But the what if on question 7, they had a disease in the previous 3 months and it had been diagnosed by a vet 5 years prior, and we had them mark yes. So the question is about, should the diagnosis time be in that 12 and 3 year period as well?
Yes.
Okay.
I mean,
So that second example should have been no. So when we're talking about diagnosed by a veterinarian or a lab, it should be in the same time frame as the question. And in the manual, our example was wrong.
Yeah.
So that's the clarification.
So here's the other thing, if we're going back and talking about questions. The question about deworming products in number 9, what's the total spent on deworming products used to go general operation for these 12 months? I think what we're gonna have to do is go back and speak with the economists
Okay.
at CSU and their student and make sure that this is accurate, so we'll get back to you on that. But I think the best way to go about this would be, what did they actually, if they bought something in the last 12 months, if they bought something in the last 12 months, we want it down here.
Even if it wasn't administered?
Even if it wasn't administered, because if they bought something a year ago and administered it this year, we're not capturing it, right? So we're gonna miss some of those, but we will capture everything they spent in the previous 12 months, which it'll be okay, because we're gonna miss those other guys that bought stuff 2 years ago. But we're gonna capture everything and continue to use everything in the last 12 months.
See, I read that question differently, and this is where it gets interesting because based on who's reading the question, you might interpret it different. Because I read it as, you're asking about those deworming products that were administered during the previous 12 months, so how much money was spent. So even if they were bought 2 years ago, if they were administered in that 12 months, you would count that price.
But see, if you think about it, so.
This is what we do in a room for like days on end.
So if you think about it from a producer perspective, 2 years ago, they may forget what they spent. So
Yeah.
it's gonna be less accurate if we do that. So I think it's better to know what money they spent in the last 12 months.
Okay.
We'll miss what they spent and used in the last 12 months. And we'll over report what they spent and didn't use in the last 12 months. But overall, on average.
It'll still give us I think either way would give us the average,
So
but,
the easiest thing for producers to do is report what they spent in the
Okay.
last 12 months. But the final word on that will come from Natalie once we met with the economists at CSU.
so you guys got that on the economic question, so 9 in the parasites section. We're gonna confirm with our economists how best they want you to answer that. Whether you answer it for total product bought that year or product administered that year, regardless of when it was bought. So we'll get back to you on that one. Expect an email from me here in the next few days. Sound good? Okay, where were we? Any other questions before we walk through section F? Jake?
So I know we talked earlier that you like another antibiotic and you were concerned like the reference card might be lost. would maybe we would write, in the case of water, we write 3 and like an arrow up that white space, right, and block in.
Yeah, that's fine. Yep.
Would that be?
Yeah, that's okay. Yeah, that's probably the best way to go about it. When in doubt, put it in multiple places, and that way we have more information than not enough. Yeah, because those spaces are little.
So if they say, the vet comes and deworms, and they have 100 sheep, and my vet charges me $2 a head to deworm them, I'll just put that down.
Yeah, that's,
You all,
what was
I
that?
said you all have to figure out how you wanna.
Exactly, that's fine. Yeah, we will. I am not an economics person, unfortunately. That's why we refer to those who have economic expertise. So yeah, we will give you more specifics on that. But I think write down what they tell you, and we can always work with them at a later date to better wrap that up in however they want it. Does that sound good? Yes, maybe, questionably. Okay, and then, so we walked through the antibiotic use in water. It's the exact same setup for the antibiotic use in feed. So if they say, no, I don't use any antibiotics in feed, you're gonna skip the table 7. If they say yes, then we're gonna ask, and here it's a little bit different, we ask about pre-weaned kids, weaned kids, and adults. And as a reminder, feed for pre-weaned kids can be milk, milk replacer, or starter. And then once again, you'll just walk through this table the exact same way you did in the one above. And that's the end of section F. Any questions before we do the scenarios? Kath
All right,
has a comment.
so, first of all, I apologize because I'm trying to do emails and other stuff while I'm sitting in the back of the room. And I really should have been paying attention.
Did I say something wrong again?
No, I didn't. I think I did. So you guys were going through the what ifs, right? Is that what you were doing? When you came up with the question about toxin versus campylobacter?
Yes.
So CAE. Okay, so you might have to bring me back up to speed, but the what if for the CAE, all right, so the problem was diagnosed by a vet 5 years ago, but it's been ongoing for the last 3 years. So yes, they've had CAE in the past 3 years, and yes, it was diagnosed, the what if is correct.
Even though it wasn't in those 3 years?
It's ongoing.
So what about, because the toxo example was yes, it was present, but no, it was not diagnosed by a vet, even though it was diagnosed by a vet in the previous year.
It's still not ongoing, they're still having abortions.
Okay, so if they had abortions due to toxo diagnosed by vet last year, they suspect that this year's abortions were due to toxo as well. That's not ongoing, that's a new case of abortions, right? So they had abortions last year, diagnosed by vet last year. They had abortions this year. We don't know if it's toxic. It's probably not toxic, because they're hurt with built up immunity. It's probably something else.
Like CE is for life, it's something that's not gonna naturally, spontaneously go away. Correct, is that what you're referring? Versus toxo is a temporary kind of
Toxo
thing?
says there is not going away easily either.
Yeah, it's not going away, but they're hurt with developed antibodies. So chances are, if they have abortions from this year, it's not going to be toxin, it's something else. So I would say the scenario in here, and the what if is correct.
Okay.
And I'm sorry.
No, you're fine. I get what they're saying. It's confusing when we're saying one time frame it's okay and the other it's not.
Well,
But you're basing it on disease type.
Maybe field people whose knowledge of disease isn't to that depth, to understand that difference is really challenging.
that's a good point.
I think it,
So how do we address that?
I mean, you either make it, it needs, I think it needs to be consistent. You either say it's been re-diagnosed, because you're getting the suspicion, and whether they've confirmed a diagnosis, you're gonna know that, you know? But if you could write in the margin, you know, was previously diagnosed 5 years ago, I don't know if you're doing that info, but it should be consistent, 'cause otherwise it's gonna get really, you're gonna get inconsistent data anyway. If they're not
yeah,
consistent.
that's my concern is with the inconsistency between the two.
The producers might raise a flag too, why do you care about this versus this agent?
Yeah.
All right, okay, so I hear you. I think, okay, I agree, and I agree. Cause we want like the best answer.
Yes.
Right, and we want to be consistent. So how do we get that word out to then everybody who gets this questionnaire and so that they can read it that way?
My
I
thought,
guess it's up to you guys, cause you're gonna be treating your good stuff, right?
my thought is, let's stick to the same time frame for the diagnosis that's asked in the questions. And let's say they did diagnose 5 years, but the question asked for 3 years. Write it in the margin if they mention that, and then we'll know.
So they will have had to diagnose it within that time frame, whatever that time frame is.
I think that's the easiest, because
Yeah.
that's what's in the question.
Yeah.
It wasn't diagnosed in the 3 years, it was diagnosed 5 years ago.
Yeah.
But they didn't have the margin.
I mean, if the vet's prescribing medication over and over, does that count as diagnosis?
That's a good question. I would say no, it just has to be that first diagnosis, and then they're just treating it ongoing. So I would say the diagnosis, if they're prescribing, let's say they're just giving you the meds that you need for it, but they haven't diagnosed it again within that time frame, I would say no, it hasn't been diagnosed. It's just an ongoing treatment. Any other comments, Kath, before we move on? We're good. No, you're good.
Sorry.
I know, so one time when we wrote these what ifs, it made sense to us. And that's why we bring you guys here, because these what ifs are tricky, and that's why we came up with them. So it's great to clarify. I think for those 2 questions, let's stick to the time frame in the question. If they provide you with information that's outside of the question, write it on the margin. Sound good? Okay, let's do scenarios here for a little bit, and then we'll jump into the last few sections.